good.
Welcome back, everyone. Next up, I have Scott Mader, founder and CEO of AseptiScope, a San Diego-based medical device company that is introducing a portfolio of novel infection control solutions to protect both patients and healthcare workers. Nice to see you again today, Scott. Welcome back.
Thanks, Anna. Nice to be with you guys again at Emerging Growth. Appreciate it. Why don't I go ahead and start through the slides? I think we might have a video to share towards the back end of the program. But right now, what I'd like to do is just talk to you about our company, a little bit about what we've been doing here at AseptiScope that has terrific impact, not only in the United States, but around the world on patient safety. First thing I'd like to do is kind of acknowledge my team. As a co-founder with three other co-founders, we have actually introduced clinical innovation with great success in the past. This example on the right-hand side of this slide is a young success story here in the Sereno Valley corridor in San Diego, California, called BioSite. The BioSite story was one that you can see tracked on this data monitor slide from that period of time, from 2000 to 2005. In gold bars, you can see the analyst projections for our new technology, which was a handheld test to determine heart failure diagnosis with patients who can't breathe properly. We actually beat, in purple, you can see that we beat analyst forecast by a complete exponent, quickly emerging to $300 million in revenue over the course of the first few years of the launch. And eventually, 2 years later, we were acquired for $1.6 billion by Inverness, and the rest is history. Everybody went home happy from that. Since that time, we've all been doing work in our respective categories, myself as a consultant until 2016, when we came across something that was very interesting in the category of healthcare-associated infection, or HAI. Now, if you are familiar with the term HAI, or at least healthcare-associated infection, you'll know that it is really an existential threat to modern healthcare delivery. Nobody should feel, whether going to the hospital or not, when you're at your most sick and most vulnerable, whether or not that's a good thing or not. Yet in the US, 1 in 30 patients will be infected with a virulent strain of a pathogen that lingers through the halls of hallways in the hospitals. 687,000 patients will be infected every year. 75,000 of those patients die. And $40 billion in direct costs are spent in trying to address this real challenge, this crisis in healthcare delivery. And progress is being made, but yet this problem persists. As a matter of fact, on the right-hand side of the slide, you'll see that it is actually not just hospitals, but everywhere healthcare is delivered. So this is a very important thing. And we got to the bottom of a significant culprit. It's called the clinician's third hand. Everybody in the world has been touched by it. It's otherwise known as the stethoscope. Now, the stethoscope is an incredibly valuable asset. It touches over 5 billion times a year. It's touching US patients around the world. Just in our total accessible market, it touches patients over 100 billion times every year. And yet the new data has emerged consistently showing that it is every bit as contaminated, the touch point of the stethoscope, as unwashed hands. Now you can see that that part that touches you, that touches your parents in assisted living, or your child when they have a cough or cold, that is called the diaphragm of the stethoscope, and it has tremendous contamination, and it turns out transmits those contaminants between patients with great efficiency. One of the most recent investigations published in the peer-reviewed literature resolves in the conclusions that we cannot wash our way out of this, and I'll explain why as we move through. This has become a significant high-profile issue in the most widely read online streaming service, MedPage Today. This was recently captured as the next frontier in infection control because it has this significant an impact with all these touch points. But the story goes back decades. As a matter of fact, 30 years ago, this was published on the left-hand side in Archives of Internal Medicine, a very high-impact medical journal. And the authors' conclusions from their study were that really we need to decontaminate or use regularly stethoscope covers, disposable stethoscope covers, between every patient encounter. And on the right-hand side, you can see that the American Medical Association actually had a resolution that they worked with the Society of Hospital Epidemiology on to have initiatives to improve stethoscope hygiene. Today, we see only about 4% compliance with cleaning stethoscopes between patients, and this is a major problem. I'll explain a little bit why, but first, a better look at the nature of the problem. On the left, Didier Patet, he's the father of modern hand hygiene in healthcare, introducing alcohol as a quick, easily used technique for hand hygiene, the foundation of infection control. And he did a comparison study between the diaphragm and the stethoscope. It turns out, rather the diaphragm of the stethoscope and the fingertips of the hands. Fingertips are the most contaminated thing that touch us. And that's why there's so much focus on hand hygiene in healthcare before and after every patient. The next contaminated thing, the most contaminated thing, is the diaphragm of the stethoscope. The problem is we really don't know how to effectively execute hygiene between every patient. If you look to the right in blue, you'll see a table. This table says return to clean status, and there's two different sides. On the left is where investigators force clinicians to clean for a full minute that diaphragm, that touch point of the stethoscope. They get a return to clean rate of 50%. It's a coin toss whether or not this is going to still have contaminants and pathogens on it. On the right, if you let clinicians use their own methodology, which involves their own techniques and the own amount of time, the return to clean status is 10%. Why is this occurring? That is an alarming circumstance. And if you look to the left, you'll see the reasons. One is compliance problems. In heavy workflow, oftentimes this is not addressed, or it's addressed with just a real quick alcohol wipe that does no good. The time you need to take is 60 seconds, and compliance with that is almost nil. Nobody has that time between each patient. Technique that's used is important in everything from washing your hands to cleaning your stethoscope, and human factors are imperfect. The material you use is also a factor, and most importantly, we have more and more resistant pathogens, resistant to things like antibiotics, also resistant to antimicrobials like alcohol. And so they simply are comfortable living in an alcohol environment. So this presents a major challenge in infection control. What we do with innovation at AseptiScope, what we've done in the past and what we do today, is we pulse the market. We look through the data, we look through the medical literature, we analyze the attributes that are most critical. We speak to futurists about it in infection control, people that use stethoscopes out in open clinic, and we identify attributes that need to go into a solution. You see 12 of them here in front of you, and there's 40 that we put into our product design requirements. And ultimately, they are things like you see in the upper left. It has to be a fast solution. You have to remove human error. You need to be able to hear through a barrier like this. And what we've produced is the Discover system. The Discover system fits right into hand hygiene stations anywhere healthcare is delivered. It is a state-of-the-art sensor-based touch-free system that allows the user to wave underneath it, activate the application, and a clean, fresh aseptic Discover built in clean rooms is introduced into that window. They press and apply. In the lower left, you see that Discover applied. It covers all diaphragms of all professional stethoscopes. They then can use it on the patient to the right with perfect acoustics. It's high fidelity, what the investigators called acoustically invisible, and it is an immediate application. Requires no training either. So this is a great solution. We have the obligation to our users to actually validate that the things that they told us to put into a design are the things that we produce that have an impact. We have a very extensive clinical library. It's available online. We routinely provide it in value analysis packs to hospitals that are evaluating our system now, and it shows that we are highly effective. We are superior to standard of care cleaning practices. We are immediate. We are acoustically invisible, easy to use, workflow compatible. And now we have the endorsement of experts, and patients prefer it because they actually can see they're being protected. We actually have conducted studies across the country looking to see if this is a good fit with workflow, whether you're in an intensive care unit, whether you're in a cancer clinic or an emergency department, this has to work for you. And so we've selected those sites across the country, and we have validated. And you can see on the right-hand side, the publications in the middle, but on the right-hand side, you see from top to bottom, 93% feel that it is easy or very easy to use. 95% believe that it improves compliance, and 95% believes that it improves patient safety. And honestly, clinicians all want to do the right thing. They just need innovation to help them do it and accomplish it. Our business model, as we go out and from a development program to a commercial strategy, you'll see stepwise on the left in the blue bars from the top with targeting hospitals and hospital systems. These are the areas where the most concentrated exams are happening to the most vulnerable patients, also where the greatest influence is in the market, hospitals around the country. We target those hospitals and we initiate use in one department where we find a clinical champion that will speak to infection control and engage in evaluations that really are looking to garner the same information I just showed you, whether or not this fits with workflow, whether compliance will be a problem or not. And then we start to get utilized as an installed commercial item. They then track it for compliance. We see reorders of our clean cassettes. These are the cassettes that pop into the dispenser that have 420 of these single-use disc covers. So this is a razor blade model, if you will. And as we see those reorders happening, we know it's working. In healthcare, you don't just protect patients in one department, you protect them in all departments. So as you get good success, you move it into the next unit until ultimately you're integrated into the entire system. That's the business model. We see it working. We've entered University of California here, the largest healthcare provider in the state, right up and down the coast. And right here at UCSD, they initiated this. We have advocates now in great areas of influence across the UC system that sing praises for this as they recognize the importance of stethoscope hygiene. And the publication I showed you on clinical user acceptance, we then reproduce in these centers. And at UCSD, we actually demonstrate on the left that people are having wide ranges of whether or not they clean their stethoscope. On the right, we track and quantify their relative satisfaction with our technology. At UCSD, you can see 100% believe it improves compliance, 100% believe it improves safety. This is proof positive to the clinicians. And so we have moved since initiating at University of California from the urgent care department in La Jolla, California, to the Bankers Hill, downtown San Diego, multi-specialty clinic, to the cardiology clinic, the Sulpizio La Jolla, brand new facility for state-of-the-art cardiovascular care. And now we are moving into the adjacent Jacobs Medical Center, their newest hospital, and from there across the state. This is the plan of Francesca Toriani, who heads infection control there, who believes that this is something that will provide visibility and then ultimately compliance and then down the road protection for all patients. So this is our business model that is in place until we actually get into the guidelines, which are imminent, by the way. Those CDC guidelines are we're part of the dialogue with that now, I'm happy to say. So we can say that those are coming this year. As a matter of fact, they're called the 2024 guidelines, where they will now require stethoscope hygiene between every patient encounter. That means in University of California Health, which covers tens of millions of lives, that every time a stethoscope goes up against a patient, they need documentation that they are protecting patients, just like hand hygiene. So this is an exciting time for us. We're out there very busy. Today, our VP of sales is traveling, I think, in Memphis with our sales rep there and off to Chicago in the following week. We have a really wonderful group of customers, a growing group of customers, and something that they're seeing that is really, to me, a valuable asset for everyone involved. And that is that unlike cleaning with alcohol, patient satisfaction goes up because in the post-COVID period, people want to see that they're protected. You can see right here, this is shot in an active clinic, the Kipper Clinic in Encinitas, California, that this patient sees what's happening, they understand what's happening. This is more blatant than, for example, an otoscope when you're having an ear exam. This is a state-of-the-art technology right on the wall. Right before the exam, the clinician waves their stethoscope, applies this disc cover, and they feel good that they're protected. On the right-hand side, just off, I've not met this gentleman, but Eric Crawley is a pulmonologist in Hawaii who commented on social media recently, and I just plucked it right off there in public domain because he says, I use this every single day, every single patient without fail. Patients are blown away by it. And you know what? When patients see that they're protected, the next time a stethoscope comes at them that is not covered, they have a problem with it. This reinforces compliance and a request for a visible solution, the Discover system. This is getting a lot of attention. And this, just a few months ago in the USA Today, was a piece that was a feature article in USA Today because of the CDC guidelines, which they've announced are imminent, where stethoscope hygiene will be elevated to just like the hands between every patient as a requirement. No longer an option to protect patients. And the Discover system has been featured in this. You'll see that in this article, if you actually search for it and read it, you'll see that in this case, the president of the World Congress of Critical Care Nurses, Kathleen Bowman, really likens this to other technologies she's seen handle clinical problems that they just couldn't do on their own in the past. You then also can hear directly from customers. This is an oncologist, Dr. Meidens, in one of our clinics in Lewiston, Idaho, where he is commenting that they've evaluated the Discover system and found it to be useful, practical, functional, and importantly, it makes hygiene reliable and timely. So it is fast and it works. For immune-compromised patients like cancer patients, you don't have room for error. They're very vulnerable to infection. If you go to the largest integrated health system in the country, the VAs across the country, you'll see that at the Memphis VA in Tennessee, that the head of infection control there, Naomi Ragsdale, is quoted as saying on the bottom bolded point that compliance with our staff is now on par with hygiene goals, which in turn decreases the risk for hospital-acquired infections. This is really obviously music to our ears. We love that the solution is actually working for folks. And if you remember back to my comment, every second stethoscopes are being applied to patients in healthcare. And this forecast that you see right here produces a $2.9 million revenue in this year, and it tracks to well over $500 million in sales in 5 years. This is something, as I've shown you, we've done before with innovation. The market is triggered when the guidelines say that this is now a standard practice, and those guidelines are imminent. Away we go. As a matter of fact, the international penetration on this model is only 1% penetration. It's a very realistic value proposition. It's realistic because look at how frequently stethoscopes are up against patients, not only in the US with a $2 billion market, but around the world that produces over 100 billion touch point opportunities for us. So we're very excited about this. I'd like to thank you for taking this stroll through AseptiScope's journey with me today. I'd like to turn it back over to Anna to ask if there are any questions or ask any questions directly to me. By the way, for qualified discussions, if you want to get into detail, please contact me directly at smader@aseptiscope.com or at my cell phone. Happy to take your call. Anna?
Perfect, Scott. Thank you so much. So noted that the CDC has elevated the guidelines and requirements for stethoscope hygiene. So can you tell us a little bit more about how that will impact AseptiScope?
Yes, as a matter of fact, I'm really pleased. We've been publishing so prolifically in this area, and my co-founder, Frank Peacock, is also our chief medical officer, and he's led a team who investigates and publishes the peer review so routinely that it's caught the eye of the CDC. We've been in consult with them as recently as just 30 days ago, where they really want to understand the changing paradigm in how to actually contain this contamination challenge. And so the way it impacts us is when those guidelines go into place, there are regulatory bodies that have a presence routinely inspecting healthcare facilities and giving them accreditation. They have to be in compliance with this type of requirement for infection control to be accredited to treat patients. So they will be looking to solutions, and the solution that is evidence-based right now and the most effective on the market is the Discover system.
And a question from Georgia asking if your technology stops with stethoscopes. What about other instruments like otoscopes for the ear?
Yes, Georgia, thank you so much for your question. And the technology that we have is not around a stethoscope cover that is placed on a touch-free mechanism to a stethoscope. It's basically the touch-free delivery of an aseptic barrier to its target vector. So in fact, we will be producing, we have a portfolio approach Our next product out of the gates is actually for this rapidly emerging area of handheld ultrasound transducers, these probes that go against patients, whether you are pregnant and having imaging testing or you come into an emergency department. These are highly contaminated and there's no real way to deal with that. That is our next product out of the gates. And we have a full range of products for that, including a very novel product for the largest market in healthcare, hand hygiene. So the first new option since gloving.
Thank you for that. Roy asks for you to talk about your patents. What is patented?
Yeah, so we have a patent family. It's organic. We've created it ourselves, and it covers the touch-free disposition of these single-use barriers to target vectors. These are the primary patent was issued in 2020, and we have subsequent continuations in part, or SIPs, that constitute patent families that cover a variety of different technical aspects and utilities associated with this technology. We've already successfully defended a challenge to those patents, and we have all of our documentation perfectly lined up. I've dealt with this in the past, and we know that when you get success, you get challenges. We're ready for them. It's not just about patents, though. Patents are protection that is absolutely necessary, and we have it. We also, in an evidence-based world, chronicle and document and prove the impact of this technology. Somebody that might copycat it may get around a workaround on a patent, but they won't have the data and they won't be able to state it. It's an evidence-based acquisition in healthcare.
Now, Mark says, obviously, you're a private company. Do you have any plans to uplist?
Well, we are represented by our placement agent in New York, Brookline Capital Markets, which is owned by Arcadia. So we have certainly had those discussions. This is something that is a portfolio approach, which is enduring. We have a tiger by the tail with our introductory technology, which is proven and demonstrated in collecting revenue. So there's a good story there. And in fact, it may happen. We're targeting several different exit options, of which public entry is one of them.
And Chris asks, in concerns of your technology and the market for it, is there any mandate being enforced?
So that's a question that is probably an extension of our discussions. So the CDC writes these guidelines. Those guidelines then become standard of care. We know that they will include provisions for the things that we provide at minimum, but it seems very likely that they will actually include our technology. They don't endorse products. They never do. But our technology will be accommodated for sure. It's the leading efficacy and it's superior to cleaning methods in all those ways I described. So the answer to your question is that the Joint Commission and other bodies come in and regulate. And if you're not in compliance with those new standards, you can lose your license to practice. So this is something that infection control has their eyes on. And we are moving very, very aggressively. We're in places like, as mentioned, the VAs, University of California, Cleveland Clinic is exploring us. So a lot of big institutions, but also everyday hospitals and clinics as well.
And Scott wants you to explain how your product is better than the thin disposable covers for the diaphragm.
Yeah, so thin disposable covers are actually what we provide, but we do so in a way that is not provided anywhere else. Thin disposable covers can be as simple as a round Post-it note. Now, the question is, do they work? There is no evidence that anything like that is effective. Touch-free is a critical component in infection control. It's called aseptic technique, and we're automating aseptic technique with this technology, and nobody else is doing that anywhere. And not even in gloving is that being done. So this is really a sea change in technology. I can give you a piece of plastic that's round and you can slap it on your stethoscope. While you're doing that, you'll be contaminating it, and you haven't demonstrated that it does any good.
And you mentioned you have a portfolio of products beyond the disc cover system. So tell us what's coming down the road.
Well, I've mentioned two things, and that's probably the furthest I'll go right now. But we've already announced that we have a very unique for ultrasound, handheld ultrasound probes. This is an exploding market and an exploding concern for infection control with no solution. That is definitely our second product out of the gates. We have our prototyping in place right now. The success of the Discover system will launch a full portfolio that will include that. And today, you're either slathering as much alcohol on your hands as possible, or you are putting gloves on, using your hands to do that you yank out of open air Kleenex boxes, unless you're in a sterile environment like surgery. So this is not a satisfied market. And so a unique hand cover product is more sustainable, uses less material, and is much more effective in 95% of gloving uses. So we have a full range of portfolio opportunities coming. Those are the next two down the road, and we'll let you think about those other ones. One of your listeners actually characterized one that is on our radar as well.
Well, we have a follow-up question with that from Tammy saying, great talk, by the way. What about other effective methods of getting tools cleaned, like UV light, steaming, bleach, chemical disinfection? How does this method compare, and what can you tell us?
Yeah, it's a great question. And I'll tell you, things like UV light, if you follow this market space, you'll see that the challenge with things like UV light, which can be very effective, is it takes time. It takes time and intensity. The more intensity the UV light, the more risk and danger to human health. So exposure is just as important as radiography to be considered here. And you can't really use the type of UV for stethoscopes, because these stethoscopes are in motion constantly and used constantly. It takes too long to effectively, and you need a direct UV light exposure in order to effectively clean it. And you can't use the kind of intensity that would clean it within a couple minutes to do so without concerns for health.
And Scott, what are your plans on selling this technology outside the U.S.?
Yes, well, it's a great question. We have full plans, as you saw in that forecast model. We now have product that is RUO, research use only, on European soil and Asian soil. We have our patents that are being prosecuted around the world and are in place in many countries around the world, the major markets, like China and the EU. So we anticipate that by the middle of next year, we will be entering our first European market. We have distributors that we have lined up, and increasingly distributors are interested as they become aware of the technology. So we've done this before, global rollouts, and we're starting in the US and then investing in country by country distribution with distributors who are proven and demonstrated to have succce.
And what's the ultimate exit plan for AseptiScope? Bought out? Have a public offering?
It's I think the money bet, if you ask our general counsel, who are kind of entry to exit folks, they'd say acquisition, because that is the way the large companies tend to innovate, is they acquire innovation. And there's a lot of modeling here in infection control that demonstrates that eventually there'll be an offer that's too good. However, you asked our placement agent, they believe this absolutely belongs in the public eye and believe in the public investment world, because it is something that resonates with everybody. We've all been touched by stethoscopes. We all now are recognizing infection control at a level we didn't before the pandemic. And so they think this resonates with the public. So we'll see. We're prepared for both.
Perfect. Well, Scott, that was a great way to close. But if you have any more closing remarks for our viewers, please, the floor is yours. And thank you again for your time.
I'll just take a moment to say this. I would love to have you check out our YouTube channel, or if you're on social media on LinkedIn or Facebook or Instagram, please look for AseptiScope. We have a full range and a growing range of things that you can see, ranging from advocacy from some of the leading investigators and influencers in infection control, to educational programs, to simply patients that have been exposed to this that are so excited about being protected. And if you engage and follow us, it's a great way to help a young startup company spread the word. And so, this is one of the great exciting things about this, is it gets contagious. Everybody, to use a phrase that resonates with our market, that the solution actually is contagious. People love to see that they're being protected. Please join us. Wonderful. And that'll do it. Thank you so much.
Wonderful. Thank you so much for being back on our conference, and we look forward to seeing you again.
Good to be here, Anna. Thank you.
All right, everyone, stay with us. We'll be right back with our next presenter.